Hi, I'm Ed Jacobs, founder of Impact Therapy Associates, and I'm here with Heidi O'Toole, who is an expert in addictions counseling, and we both are currently teaching at West Virginia University. And what we're going to do is Heidi is going to show how to use the stages of change concept. First she'll talk about it, and then how to use it, and I'll be role-playing an alcoholic guy that is in between pre-contemplation and contemplation. So how do you want to...
Well, the stages of change, of course, was developed through the addictions field, and it is a staple to assess where a client is at any given time, and then also used to track progression and used as an intervention.
How did impact therapy tie into it?
Well, impact therapy, once you have the model, which is stages of change is a model, it frames up the approach, which is impact therapy. So we can use impact therapy within the framework of the stages of change.
And the other thing that I think you do so well is you make your counseling visual, which is certainly what we want to do with impact therapy. That's what impact therapy is making counseling visual, making it multisensory.
Right. So what I do with the model is show the clients, using the whiteboard, show them the different stages of change, where they would be according to the information they give me. And then I tie in the 12 steps, which of course is the other model that's so infamous with addictions counseling. So you tie in the stages of change, which is an assessment model that we use, and then the 12 steps, which is the treatment model we suggest clients use.
Okay, so let's say that I'm a client and we've been talking and you've assessed, and I don't know, it could be a second session.
It could be a second session based on the information you've given me. Yeah. So here's how I would work the stages of change model in my mind, assessing, and then I'll teach the client. So I would say something like this: based on the information that you have given me, Ed, I'd like to show you something. This is a model that we use to help us understand where it is you currently are and your perception with your drug and alcohol use, and yours is alcohol use particularly.
And you get up and do this?
I just get up to exactly...
And you have a whiteboard in your office?
Absolutely. And this is exactly the way I would do it if we were in session. And I would say, Ed, I'd like to show you something. This model is called the stages of change. Change is a process. It's a difficult process.
You got that right.
Yeah. If change was easy, we'd all do it. But it's not, and I think this model can really help you, and it'll help me.
I want to quit, but I just...
Yeah, and that
I
one
think
thing.
I want to quit.
Well, sometimes you do, I think, and sometimes you don't. It almost looks like this for you. Some days you sit here, and then other days you sit here. Remember we talked about that little guy that just wants, I want, and you shift back and forth to, I want to be able to drink without consequence, but I want to live a life with my wife, with my children. I don't want to affect my job. So you go back and forth. And that's what this model is going to show you. The first stage is called pre-contemplation. And pre-contemplation. And contemplation is just a big word for think. Okay, pre-contemplation. We're usually in a very emotional state when we're here. Going back and forth, undecided, confused, angry, all of what you've shared with me. The next stage is really where you and I have been working with one another, is contemplation, okay?
Yeah, you had me with all that stuff last time. I really had those images in my mind of that small chair and the box.
And how the alcohol...
I'm thinking more about
That's exactly what contemplation is, thinking.
It messes with my drinking.
Well, yeah, because then you'll go, well, wait a minute, and that's what we want. I know it's very awkward and uncomfortable to drink when you're thinking, wait a minute, if I do this, then this happens. But for your recovery, that's exactly where we want you to be. And so what happens a lot of times, that early on, you go back and forth between pre-contemplation and contemplation. I don't want to do this. Yes, I do want to do this. I don't want to do this. Yes, I do want to do this. Change is difficult. So while we're right here, my purpose is to hold you here, because if I can just get you to think about what this stuff is really doing to your life, okay, then I've got an opportunity to prepare you to be able to do something different. See, preparation is the third stage of change, okay?
Okay.
And so once, that's what, we're going to spend most of our time preparing you to be able to take a different action. And the action is recovery, okay? You just can't go from drinking for 19 years into recovery, okay? There's different actions you have to take to stay sober, all right? And then once you begin taking these actions, notice how there's an ascension. The quality of your life begins to change. I can promise you this, that if you participate in this process, the quality of your life will begin to change, and you will be able to maintain a sober lifestyle versus going back and forth into this addictive lifestyle.
Wow, that's helpful.
Yeah.
Let's talk for just a minute about what you were doing. And this is, by the way, these YouTube clips are meant to give you a sense of impact therapy, give you a sense of what we're about, what Heidi's about with the field of addiction. And you do all kinds of it. I mean, addiction is not just alcohol.
No, all drugs,
and
process
this model
addiction,
works
with every type of addictive process. So it can be drugs and alcohol, the chemical process, also with gambling, eating disorders, some of the the internet addictions.
And the thing that I like about this, just even role playing the client, and what we're selling is the idea of make your counseling visual. Advertisers certainly do that. So we think that that's what impact therapy advocates, and that's exactly what you did. It's a visual thing. It engaged my brain more, and certainly I think in the addictions field, you've got to get their attention.
Well, you have to get their attention. Their brain process has absolutely been interrupted, and so the more we can use to engage their brain, we try to use all 5 senses. Visual, of course, in addition to talking, those were 2 senses right there. And then we use the props when sometimes we get the client to move from chair to chair. As many senses as we can involve, it fires off as many neurons, and again, it increases, not just engage, but it retains. The client will retain.
Impact therapy is not just talk, listen. That's what we believe, that the more that you can develop in counseling, getting away from talk, listen therapy, the more impact you'll have. For more information about impact therapy, go to the website impacttherapy.com.